Hi there, Dr. Joe Arve here, your spine geek, max living doctor. I want to make this video for you to help you get used to your equipment, your kit, and to use it to make sure we can get spines corrected and get you going back to green grass. Like we talked about at the report, it's important that we do our visits, make our adjustments, but also do our home spinal brushing. So I made this video to help you set up the cervical traction unit part that can help you bring your healing to your spine, to your brain, to your body, and get you green grass. And again, you should be doing this every day, working up to eventually 100 little tractions. Again, when we do the traction, we're not here to jerk ourselves, you'll see in a minute. It's just little tractions with the head in an extended position, simply just to get your brain and nerve system to relax for everything we did that day. And so I'm gonna have you set, first thing you're gonna do is you take your block, and again, we've set it up. If we haven't done it already, you wanna basically pull on the strap so that you make it as short as possible, okay? This part's gonna go over the door. This part is where this traction unit's gonna go through, this loop right here, okay? But you wanna take the strap and you wanna make it as short as possible so that literally where the buckle is, okay, or where the beginning of the Velcro is on this strap, that's where you want to go. You don't want a lot of slack in here because then it won't have enough room. So you take this part here, okay, you're gonna open your door, put it over the middle part of the door, that's the strongest part, and you're gonna close it, okay? Now it's secure. You can take your finger through the loop here, and you can just snug it, okay? And that's where it's gonna hold, all right? Then you take your traction unit, okay? And again, if you're watching this and you're an older patient, this is new, okay? You're gonna take this part of your traction unit and you're going to string it through the loop just like this. Okay, string it through the loop. This is live now. Okay, so I've got it through the loop, right? Now once it's through the loop, okay, you can control how high it goes, right? I have it here, okay? It's just right through the loop. You can control right where it's at, okay? So I want to put this right at chin height, okay? Right here for me is chin height. Then I'm going to take this, okay? And I'm going to tie a knot. I'm going to tie it around. So I take it here, and I tie it once. Okay? And just to make sure, I put another tie in it. And now I've got two knots and my unit is holding. If you have someone else in your family going to use it, simply untie the knot, okay, once, twice, and you can make it higher for them or make it lower for them, for your children. So you can adjust this wherever you want, okay? So basically I'm gonna have it for me at my chin height right here, okay? I'm gonna tie it up once, and then twice, okay? And it's good to go. Now you're ready to do your traction. You have it set up. You can leave it like this at all times, okay? It's gonna be safe. It's gonna keep you away from the door. Just make sure someone doesn't open the door on you, right? But just check it. Give it a tug, okay? Now, when you do this, there's some important keys to make it simple, okay? It's at your chin height. You're gonna make sure these fat parts are out on the end. Unless I tell you, you don't need to have them on your neck. So you're gonna have your neck right here in the center part right here. You don't need to just move these out. You don't need those right now, okay? You're gonna take your traction unit and you're gonna put it behind your neck and then under your chin, okay? You're good to go. You're good to go. Now, what you're gonna do now is grab it like this and you're just gonna do little, I'm looking at the ceiling and just little tractions, little ones. Like this. You're not jerking, you're not cranking, because here, God forbid the door opens or this comes undone, I'm still standing here. I'm not gonna fall down. I'm safe in a safe position. And then you're gonna work up, sometimes 30, 1, 2, 3, can't talk at the same time. Eventually up to 100, and it looks like this. That's 10. You can do 100. Shouldn't take you more than a minute or two. But the good news is that You're safe. I'm safe. I'm standing right here. This is not holding me. I'm using this to put my head in extension, look at the ceiling, and just take the tension off my spinal cord. Real easy. Not hurting my jaw, but I'm getting a good, effective stretch. I'm working on my posture. I'm undoing the kinks from that day's worth of stress, and I'm getting my spine and my life and my mind going to the green grass zone. Just like that. Okay? So that's cervical traction, part of your spinal brushing. Again, now you know how to set it up. You know how to go up and down and set it for the patients of their family, if they're patients of ours. Okay? That's the cervical traction unit. Start at 5, 10, 15, up to 100. Once a day at least. If you want to do it more, do it more. Not any time should this ever cause pain or dizziness or anything. If it does, stop immediately. Not any time should you worry about if this comes undone, you're going to fall over, because you're not going that hard. Again, you're just an extension, giving little pumps, little kisses to help your brain go into what we call a positive neural image to get the extension going and have a positive green grass effect on your nervous system. So again, Dr. Joe Arve here. Get this set up, use it every day, and watch power and healing and fun return to your life. Be green grass strong. Be part of Spine Geek Army, okay? If you have any questions, go to spinegeek.com or message me or text me, and we'll make sure we'll get you healthy and strong. Have a great day. Bye-bye.